I am Nahid Kabbani, and this is the Lighthouse for today's viewers. Welcome to our show. Today we have a really nice story for you, my viewers, to show you how important the community TV. We always bring you stories from here and there, but today I'm bringing a story from a patient. He loved the way his doctor treats him. So he brought the doctor to me and he said, will you please let us meet this doctor to let people know when they need kind of service like this to know where to go. So let's introduce my guests to you, my viewers. Welcome to our show.
Thank you very much. Thank
Will
you
you
for having me
please
here.
introduce yourself to
Absolutely.
our guests?
My name is Chris Kurosh Arbabian. I'm originally from Iran, and I graduated from University of California, San Diego, in biochemistry and psychology. And I decided to pursue chiropractic care because I was injured in a sporting accident, and I found that chiropractic care really healed me in a lot of ways, where I was able to feel better, get up and walk around, and not have pain without taking medications. And as I was growing up, I was under medications for certain ailments, and again, symptoms chase the problems, but we're not going to talk about that. I became a chiropractor because I fell in love with the fact that, wow, something non-prescriptive helped me. I was so ecstatic about it, and I was introduced to it by a friend of mine. He's like, yeah, he was a Navy SEAL, trained to be a Navy SEAL, and he took me to his chiropractor, and I was like, after a few adjustments, I was like, wow, and I felt like this passion that this doctor had. And I didn't know that chiropractors were doctors at that time. I'm like, what, you're a chiropractor, you're a doctor? And a lot of people misunderstand the concept of chiropractic and doctors. But the fact is, chiropractors are primary care physicians in the state of California. A lot of people don't know that.
Can we keep the information for our viewers for later?
Sure,
Okay.
absolutely.
And we have another viewers also. You can talk to them through this area, this
absolutely,
area. And
absolutely.
me, talk to me, please.
Okay. I apologize.
That's okay. Nothing to apologize about. Will you please introduce yourself to our viewers?
Hi, my name is
My
Andre.
viewers here too.
They're everywhere.
Yes.
My name is
This
Andre.
is the camera.
And
Repeat your name to clean up that person.
Yeah, my
one
name-
here. This is your camera.
my name is Andre. My name is Andre Howard, and Chris is my chiropractor. And I would say, when I was 17 years of age, I experienced a car accident, and it took about 2 decades to figure out what match the symptoms with the ailments. And Chris has been very gracious in educating me in how I should adjust my new life with what I am now.
So you were in pain until now with that accident?
I think I had youthful exuberance, so my body did not necessarily register the pain. However, I have moments of blacking out. I have moments where my body does a complete shutdown if I do not take care of my body.
Thank you very much. That's what Andre brought to me, the information about his chiropractor. He came to me to the lab and he says, I have a story to tell your viewers, and I like to tell specifically the Arab community because no for chiropractor and things. He noticed that from his chiropractor. And I know our culture, they don't believe in doctor, they believe in natural and natural things to heal. That's why we don't use this kind of professional. That's why also our doctor, chiropractor here to tell us more about what is in it for us as medication. So first of all, most of the people confuse between chiropractor and physical therapist. What is the difference between?
That is probably the best question you can ask me. First of all, doctors of chiropractic go through a lot of training from the perspective of understanding the anatomy, physiology, neurobiology. A lot of basically everything you can think of that a medical doctor goes through, except that we don't focus on pharmaceuticals because we don't prescribe medications. That's the only thing that differs us from medical doctors. Otherwise, we go through the same boards. Here's an interesting thing. Medical doctors take their boards on a multiple choice question test at like a place like a Sylvan Center, which is where you go there and you sit down and you give them your ID and everything. You take a test. On the other hand, chiropractors, we have to we do mock presentations, mock testing, which means that we have a door, we have a patient, we have an actor patient, we have an actor doctor, and we have a facilitator who basically, when we read a board that says this patient has X, Y, Z, and these are the problems. When we walk in the room and we have an actor patient, we have an actor doctor, when they're sitting there, and we have to basically go through the protocols of what's going on. And then we have a facilitator that examines us. And this is 2.5 hours of this. No other profession in the medical industry has this, which makes us profoundly more acceptable in the eyes of the public, because medical doctors take their boards on a multiple choice question test.
Check your heart, check your breath.
We do, thank you for asking that. We do, there are stations that ask us that, and then there's a facilitator that says, okay, listen to his heartbeat and tell me what this is. Is this normal or abnormal? And again, we're not trained to be cardiologists, so we just have to learn, is this normal, abnormal? And we just say that. That's fine.
But what is the difference between chiropractor and physical therapist?
Chiropractors and physical therapists, the difference is we have a license to diagnose and treat patients based on their symptoms, whereas physical therapists treat the symptoms.
Okay.
We, by law, by the state of California, we're primary care physicians, so by law, we're responsible to say, okay, this patient this is their diagnosis, this is their problems, and they have to, this is the amount of care they need. Physical therapists will treat those symptoms. Let's say they have a muscle strain, which is a muscle problem. Physical therapists will use muscle stimulation, ultrasound, therapy, exercise, a lot of things they'll use. But by law, they cannot adjust a patient. Only a doctor of chiropractic can adjust a patient by law.
So if there's a car accident somebody got involved with,
Yes.
the report,
Yes.
which report will be more effective for the car accident, the chiropractor report or the physical therapist report?
Oh, well, absolutely. A chiropractor, because the first thing we do is we bring the patient in, we do x-rays, and we do a series of x-rays. We do it's called a flexion, extension, and open mouth, where we check that, where we take a picture of the atlas, and we have them open their mouth, and we check to look at their atlas, which is the
balance.
the second bone that they have, and we make sure we see where it's at, and then we do an anterior posterior, which is called an AP, which we take this way, which is from the top of the bone all the way down the first cervical, as well as a lateral view to see how the curvature is. So we take, it's called a 6-view shot, which is basically a complete, and then we do a complete history, and we do a complete examination. And unless you have that information, you don't know if that patient has an instability in their top bone. Because if there's an instability in the top bone, that can be a problem, because if there's a problem with there, that person can become paralyzed if it's not stabilized. That's why we take all the different views, flexion, extension, to see if the second cervical vertebra moves back and forth. If it does, then we've got a problem, because the transverse ligament, that's what it's called, is moving. And if it moves, then that patient can possibly become paralyzed if they're not in a halo, which is what ambulances, trauma surgeons utilize for stabilizing a patient. We need to know that. Yeah.
And the chiropractor will give the days off for the patient.
Exactly.
If they need
We
it
look at that. Yes, we look at that, and if there's instability there, we will notice it, and we will refer them out to an emergency room, and a trauma surgeon or a neurosurgeon who
we can say the physical therapist take over after the.
A physical therapist will take over on a case that has been stabilized for rehabilitation, and some of that can be covered under future medical care. Sometimes a medical doctor can refer to a chiropractor for a series of treatments, which may be 3 months, which is what our usual protocol is, for the sake of the patient.
The body to come to normal position.
Exactly, exactly, and a lot of times we work in correlation with physical therapists in treating patients. And currently, I actually do have a patient who's closing out his case, and he's seeing a physical therapist. And again, we work together, and it's in harmony, and it's fantastic, because it's a win-win situation. Because our goal is to get the benefit of the patient.
That's wonderful. At least we can tell now what is the physical therapist duty, what is the chiropractor.
Absolutely, we work together, but the goal is for the best interest of the patient. That's what we work for.
Andre, you have been with Dr. Chris for physical therapy, for chiropractoring.
Yes, chiropractic.
Okay.
Yes, and I received physical therapy with the Veterans Affairs.
That's
been recent. Yes.
I will not ask that you were so happy, because you are so happy. That's why you brought your doctor to the show also.
Yes, and mainly Chris has been such a great educator, and I thought that community access would be a great venue for Chris to educate the public as to the benefits of natural healing.
That's wonderful. And you heal now? You are okay?
I'm in the process of healing.
That's wonderful.
It's baby steps.
What is the best, what you like about Dr. Chris?
There's a lot of things. I mean,
No.
we don't have time for all
talk
of
about him.
Oh, I'm sorry.
Yes, he will say
Okay, all right.
about
Apologies.
what he likes
Sorry.
the best.
What I like about
There's a lot of
the most of his treatment.
My treatment. I'm constantly in pain every day of my life, and there's a major discomfort. When I was in a car accident, I subjugated my C1, C2, and as Chris was explaining, is if your vertebrae are off, that could cause some problems. So, constant migraines, constant tension headaches. When the body does not feel good, it's difficult to be a positive person because the body's in pain. So, that's been the biggest challenge, is trying to keep a positive attitude while my body is healing.
And I can see the results. You are in great shape and great positive feeling, and we will talk about other things after the break.
All right.
We'll have a break and we will be back soon.
You're watching The Lighthouse for today's viewers, brought to you by oneworldforyou.org.
So, because we have a value information for you, I like to find a way to take it from step by step with Dr. Chris to tell you what to look for be able to benefit if you have these symptoms or the family member have these symptoms to go ask for help. What is the popular thing you can face from the community or in life need chiropractor attention?
Well, to give it simply, basically, is people, unfortunately, we live in a society where people come to care when they have problems.
Mm-hmm.
So I would call that a sick care system. I wouldn't call it a healthcare system, because a healthcare system to me tells me, in my mind, somebody who goes in to see a doctor, a chiropractor, an acupuncturist, a nutritionist, it doesn't matter. The point is, you're going in to see somebody for your health. So sick care is somebody who, when they get sick, they go there, see them.
Mm-hmm.
But it's not healthcare. But we talk about healthcare as if it's, it's what we do, but we don't do that. And that's sad. We, as advocates of healthcare, me as an advocate of healthcare,
Mm-hmm.
need to focus on children, the younger generation, and people who are growing up to know that it's not like that. Healthcare means you go to the doctor when you're not sick, not when you get sick, because then that's sick care. And for the most part, that is a problem, unfortunately, society has. However, I'm not going to focus on that. I want to talk about how we can get our community to focus on that. That is, don't wait till you're sick. Don't wait till you get the sniffles. Go regularly check, see your doctor, see your primary care physician, see your pediatrician if you have children, see your chiropractor, and get checked. Make sure, as long as when you're healthy, because in the eyes of the healthcare system, that's what we want people to do. Because when you're healthy and you get checked, then guess what? You stay healthy, and that's the goal of healthcare. To me, it's called healthcare, not sick care.
That's a good point. And
Yeah.
the body is bones and veins and muscles.
What
Bones are important
exactly
to the body
what
to balance.
Nahid, what makes the body can heal a body.
Mhm.
That is
That's good. What
It's-
about
it's a fact.
babies or kids? Popular things they
absolutely
need to go.
babies, children, the birth is the most traumatic event a child can bear.
Mhm.
And the fact that especially if it's natural birth, they go through so much traumatic issues. And as doctors of chiropractic, we check them, and a lot of times some of those children will be misaligned, and we check their spine, we make sure that they're aligned. And a lot of people may look at movies and say, oh, I saw this movie, this action movie, and this doctor did this, or this actor did this and this, and killed somebody. But doctors of chiropractic are very gentle. We have the most conservative form of healthcare. Our malpractice insurance is absolutely it's so insignificant. It's like so cheap. It's very cheap because we don't kill people, we don't hurt people, and that's a fact. It's just the reality.
In fact, you help them to heal.
Exactly, and that's the reality, because we bring the child. You bring the child into the office. I have a 2-year-old who's 2 years and 2.5 months. I will show my daughter's picture whenever we have time. I will, and her name is
Next time.
Donya.
Dunya?
Yeah, her name is
Okay,
Donya.
that's
Yeah.
good.
Yes,
That's
yes.
good.
The love of my life. But that's besides the point. But children who are born naturally are traumatized because of the way they're
They
birth
go
the birth
out
is.
to the world.
Exactly, they go out in the world, and we have parents who bring their children in, and we check them. And some children have their atlas misaligned, which is a top bone in their spine, and we checked it. And sometimes they're misaligned, and we adjust it. Now, certain children, as they get older, they'll develop a symptom of constantly crying in the middle of the night, all these problems as if they have gas. But a lot of times it's called a colic syndrome. They're colicky.
Mhm.
I'm sure that term may be familiar with a lot of your audience. But colic syndrome is a symptom of just constant crying, nagging for a child.
Is there any reason for that?
Absolutely.
My neighbor's kid. Tell me what is the reason to go and tell them about it.
Their upper thoracic spine needs to be adjusted. Because what happens, the upper thoracic spine, when it's misaligned, like if I can use my thumbs as a spine is, and this is like the spine right here, and if it's slightly tilted this way, it'll put pressure on the nerve. Because the entire nervous system comes down the spine. And that's why chiropractors are so fantastic as what they do. Is because we restore the nervous system and it allows the nervous system to function the way it's supposed to. And so when the nervous system gets dysfunction slightly, just a little bit, just even a few millimeters, it's like putting a pressure on the hose. You put a pressure on the hose, the water doesn't go through. That can cause dysfunction in the way they breathe, and when the way the child breathes.
Uncomfortable.
They're extremely uncomfortable, and then they cause extreme uncomfort to the parents.
Yes.
And so what we do is we go in there and we treat it, we adjust it. Now, we don't adjust them like Arnold Schwarzenegger may do in a movie where they twist a neck like this and like this. That's Hollywood. Chiropractic care is not like that. We adjust them very subtly, very gently, and it's like very gently like this. And like with children, we just use our index fingers and our thumbs, and we just go through and we check them. It's very conservative. A medical doctor has a malpractice insurance of $50,000 to $60,000 a year. A chiropractor's medical malpractice insurance for $3 million coverage is $700. Why? Because we don't kill people. It's very simple, and that's why I'm so passionate about what I do.
I don't see gun or something.
No.
Thank God.
No.
But you mentioned insurance,
Yes.
chiropractor.
Yes.
Can I go through my insurance to chiropractor or some insurance?
Exactly. There are chiropractors that cover certain different health insurances. Depending on the insurance you have, you can see a chiropractor. And a lot of chiropractors, if you don't have health insurance, and if you don't find it convenient to go, let's say, you have, let's say, Western Health, for example. I don't know if you do, but you may, but I don't know.
Okay.
It's irrelevant. And let's say the closest doctor to you that has Western Health for chiropractic care is in Roseville. And you don't want to drive all the way out to Roseville. You can see any chiropractor you want. You can come see me. No advertisement. No, I'm not advertising.
No, but I mean, chiropractor.
Yes.
Yes.
Chiropractic care is covered under many healthcare plans. As like, for example, Kaiser has a policy where a patient can get chiropractic care if they like.
Yeah.
But it's an elective, which means that you're getting your now is open enrollment, which means that you can choose what kind of care you like. And let's say Nahid says, I like to get chiropractic care, and let's say Nahid has Kaiser. Nahid, you can go online or
check
and you can get chiropractic coverage for yourself. And chiropractic coverage usually covers 12 visits a year, based on what you get for the Kaiser or HealthNet. I'm not
Any
sure.
program have different categories.
Absolutely,
Yeah,
absolutely.
We have to look at those things.
Everybody can get chiropractic coverage.
Well, that's
if they like. Absolutely, it's a choice. It's a choice. However, if you're under HMO, you have to stick with HMO policies, and then you have to go to the doctor that is in your network.
Most of the insurances have their book like this. They have their own physicians and pharmacists and everything.
Exactly.
It's normal, but I meant it is covered.
Yes.
By insurance.
Absolutely.
Then we will say if they like you, they will follow you. But
200%. Any chiropractor, chiropractic coverage is covered under health insurance.
Okay.
Absolutely.
Okay,
Absolutely.
That's good. Okay, we talk about. By the way, relax. The chiropractor will relax you.
I am
relaxed. Okay. Because he's talking, but you are listening.
Yes.
So, we talk about the child.
Yes.
What about the aging people, the senior people? What is the famous and the most popular thing?
And that's a very good question. I would have to say probably 30% of the patients that I do see are over the age of 50, 55 and older.
They're still babies. 50, 55.
My father's 67. My mom is 62. So
Okay,
they're
like
baby
my kids.
boomers.
Okay, continue.
Yes. And again, it's amazing to see how interested they are with all the changes that's happening, and they want to know more. They're more passionate about their care than people who are half my age. I'm 42, and they're so much more interested about, well, what can I do? My parents, my dad, my mom asked me, well, what can I do about this? What can I do about this? And I'm like, okay, well, let me come to Stockton and we'll sit down, we'll talk about it. And they're so very passionate. And the thing is, yes, we're in a baby boom generation where they say 8,000 baby boomers, I guess, become baby boomers every day in America. That's a lot.
Yes.
And so, what
Because
can we
of
do?
the health, good health, we're still alive.
Exactly. You know why?
That's
Because of the
why
way they
you
were
have
brought
more
up.
and more
They
people.
were brought up with a very positive way of thinking about life. We were not, per se. They are smarter than we are. We need to be 10 times smarter than they are.
In fact, you will be smart. Ask experienced person. You will be smart when you will be at that age. Now you feel
Yes.
your parents are smart and your generation is not smart. Believe me, they don't care enough, but they are smart. But when you are at that age, no way to control what that changes in your body and your health.
Can I say something? My dad always told me, he's like, when you have a child, then you'll know what it's like to be a father. Until you don't have a child, you don't know what it's like to be a father.
And when you are grandfather and you like to enjoy your grandchildren,
Yes.
you like to
Be
take care of your
healthy.
health to be able to
Yes.
enjoy your
Yes.
grandchildren.
Yes. So one of the things that I encourage baby boomers, people who were born after 1945, 1946, is to get checked. Get your spine checked. Considering the fact that, there have been maybe serious degeneration that it may have happened in your spine, whether it's a car accident, whether it's lifestyle, whether it's being in, war, whatever, doesn't matter.
Visit the chiropractor.
Visit
check
because
on.
the sooner you check, the sooner you can do something about it. Because I can, a chiropractor can show you what's going on. Look, this is what's going on. These are the problems, and if you don't do something about it, it's just gonna get worse and it'll accelerate. But I believe that
I agree with you. Actually, we always don't check until we are in the middle of situation. Hard to believe, hard to take care of it. We have the disaster, then we go. It's not calling cancer, it's not disease, but at least we should know, talking about myself and you. We have to check what we have to take care of the small things before it becomes bigger and harder to take care of. Ask me about age. All of a sudden, I find myself at this age and those problems, and no way to take it away. So take care of yourself before you're stuck with that thing. And after the break, we will talk more and more about it.
oneworldforyou.org, promoting cultural understanding through the media.
So now we have 2 chapters. We can repeat it and talk about it in details. One, the baby boomers, which has become more and more baby boomers, and the second one, the car accidents, because with the way we treat the technology, the way people fix it and do things, more and more car accidents. So I will talk about the old generation, which they didn't have car accident, they didn't hurt self, but the age hurt them a little bit. Let's see what is in it as chiropractor can help us and give us kind of advice. As an old woman, I feel the pain of old people and the arthritis and things from work also.
Thank you for.
Bones are not healthy sometimes.
Well, I will give you a simple solution. Okay. It's between honey and cinnamon, and we can talk about that after the show. But
okay.
Honey and cinnamon can cure pretty much almost everything.
Okay.
However, you talked about arthritis. Now, arthritis, in the definition of medical text, means the pain in the joints.
Mm-hmm.
Now, we use our society uses the word arthritis as if it's a word you can just throw around, but it's a powerful word.
Rheumatism?
Well, no. Rheumatism is an autoimmune disease, which means that it's part of the body, part of the immune system of the body that attacks itself, which causes inflammation.
Mm-hmm.
But that's what rheumatism is, which is related to lupus and other autoimmune diseases.
Mm-hmm.
And most of it is inherited.
Mm-hmm.
So you pass it off from your family, like from one
Okay.
family to another. But arthritis, as a general term, means joint pain.
Mm-hmm.
That's what arthritis means. It means nothing else. That's what it means. So people throw that on the word, oh, I have arthritis. Well, that means you have joint pain. However, there's a lot of things you can do about that. Now, baby boomers are the best candidates for using the alternative care for health.
Mm-hmm.
That is, simple things of honey and cinnamon and fish oil.
Mm-hmm.
Fish oil is the most profoundly effective way of reducing inflammation.
Mm-hmm.
Systemically, which when I say systemically means to the heart, lungs, the blood vessels, everything.
Mm-hmm.
Fish oil. And when I say fish oil, I don't mean the fish oil that you buy at Costco that's a pill. I'm talking about the fish oil that's like liquid and it's refrigerated in a health food store like Whole Foods, Sacramento Co-ops, any of those places that have a liquid form that's refrigerated.
I raise my kids with that fish oil, but I take the pills myself, which
Okay.
is better.
Oh, the liquid form that's refrigerated is much better, because the reason I say the liquid form is better because of the it's bioactive, which
Mm-hmm.
means that the oil, for the oil to be active in your body, there's a term that's called bioavailability, which means what does your body absorb on a general perspective. So if you take a pill, you think you're taking a pill that has 50,000 IUs or vitamin B12 or whatever. You think it's like a mega vitamin. You take it, you become Superman. No.
No.
What's important is what your body can absorb. It's called bioavailability.
Mm-hmm.
Bioavailability is the ability for your body to absorb a medication or a natural supplement like a vitamin
Mm-hmm.
or a fish oil. So that's why me as a doctor, and probably most other doctors in the health industry, will recommend buying fish oil that's cold, refrigerated, liquid form, rather than a pill form, because pill form is cheaper. And most people say, well, hey, fish oil is fish oil. Let's get the cheap one. But that's the difference. This is not where you want to discriminate between, money, because the liquid form is much more effective. And for the baby boomer community, where you are, sorry.
No, I'm over it. Don't
Okay.
worry. Don't
All right,
be
all
sorry.
right.
It's
But-
okay.
I mean, like I said, my parents, I have a 62-year-old mother and a 65-year-old father.
She's still young.
Very young.
I'm 72. Don't worry.
Right. We have 8,000 baby boomers every day. Fish oil, liquid, refrigerated, best thing. It'll decrease your cholesterol, triglycerides, and it'll decrease joint pain.
Mm-hmm.
So back to joint pain, arthritis.
Yes.
This is what I recommend. Bottom line, do not take the capsules.
Fish oil.
Fish
And
oil,
honey.
omega-3, only omega-3.
Okay.
Not the omega-6, not the omega-3, 6, and 9. Only exclusively omega-3.
And honey. Honey will help.
Yes. 2 tablespoons of honey and 3 teaspoons of cinnamon
Mm-hmm.
over a period of a
Powder?
month. Yes, cinnamon. You buy
We talk about these 3 spoons.
teaspoons.
Teaspoons.
Yeah,
Cinnamon.
cinnamon. Yeah, you
Yeah,
put it in the
I know.
water. Yeah,
Over
You
a
have
month.
it on.
yeah.
Over the food?
Yeah, one time a day
Okay.
with honey. Yeah, believe it or not, it's powerful.
I will believe it. No, I know.
You can do. I mean, everything I say from the heart, but it's also research proven. So I don't say anything that's not research
I will
proven.
try it and then I will tell you. Try it yourself, baby.
She'll be doing laps around this building. Trust me, she'll be running faster than anybody else who's playing.
Really?
Absolutely,
Okay.
absolutely, no doubt about
From tonight.
it. All right, good. All right.
Okay, so this is for the joint.
This
bones,
absolutely
for-
joint arthritis, arthritis
Okay,
pain,
good.
cholesterol, immune system, anything that
That's-
has to do with your health. Cinnamon honey is amazing at what it does.
And the car accidents. What is the major things?
Well, car accidents.
Dangerous things.
Absolutely. Well, what happens in car accidents is you have whiplash, and what the term whiplash means is you have excessive force that goes forward and backward. And so what that does to the spine is it causes a lot of misalignments, and it's trauma. So we call it trauma. We call it this. You get post-concussive syndrome, which means that it happened. You don't know why it happened, and this happens to everybody, depending on how much it happens and how severe it is. But it happens, and we see it every day. We see it every day. Why? Because everybody's in a hurry. People are texting. People are on the phone. People aren't paying attention. You have people who are on motorcycles who drive between cars. Only in the state of California, which does it, which I think is ridiculous, because those motorcycles are at risk.
More dangerous than.
But people do it. But it happens on a daily basis.
Yes.
So, car accidents are something that we do see on a regular basis, and we do take care of. And again, because people's spines misaligned, over a series of chiropractic care, we do treat it and take care of it, and usually within a matter of 3 or 4 months, a lot of them get 90% better.
That's wonderful.
Yeah.
So with Andre, what did you take care of?
Well, Andre came to my office with a series of conditions that he had, and that was with sleeping and with having a certain problem with some balance issues and stuff. And so I treat Andre
Through
from
car accidents also? Or
No. Again, by law, a chiropractor cannot talk about a patient's.
But he is here.
patient's,
That's why
I would
trying
rather.
to talk to
I would
him.
rather. I would rather. Let's hear from Andre.
What's the question?
Share with us.
I was in a car accident at the age of 17.
Uh-huh.
Drunk driver hit us, and I have about 20 minutes of amnesia. I hit my forehead on the dashboard, and it's possible that when he hit us, his helmet or his shoulder hit the back of my head. So I have possible 2 points of contact on my brain. It ended my military career very early, so I'm medically retired from the Air Force. And for some time, no one's been able to
Figure out what.
figure it out for sure what's going on. And so through the chiropractic, I understand that it's a structural issue that I'm dealing with. And once we understood that more, I've been able to do yoga. Yoga helps a lot, and modify my life to the point to where I do not overdo it.
That's wonderful.
Yeah.
And I see you from time to time, really, around the Access activities.
Right.
What are you doing in Access?
I volunteer my time here at Access Sacramento, and I am an aspiring producer. Motion picture, cinema preferably. So, yeah.
So from military to.
Military, that was more of a family tradition, and I truly believe that giving oneself to something bigger than themselves, hopefully in the pursuit of mankind goodness, that all mankind, regardless of their religion or their gender or whatever their humanity. We're all one human
we
race.
miss that, yes.
So if we do not help one another, then what's the point?
Yes.
So
That's
in
the
a way,
best what you can do in life.
yeah,
Be a human being.
exactly.
Yes. It covers all needs. Simplicity.
Yes.
Yeah, that's good. So you are planning to do film or?
Wow, I've actually been in motion pictures for about 20 years. And it's technology that has changed so much. So for the past few years, I've been developing and writing. and we'll see where it goes. I'm currently adapting a novel into a screenplay, and that's been
wonderful.
fun. Yeah, it's called A Yellow Cotton Dress. The adventures of a young lady growing up, which is interesting as a male writing
Yes.
a screenplay for women. It's great though. It's good.
Life is full of activity, interesting for writers and motion picture.
Yes.
There's a lot of unbelievable stories in certain areas in the world,
Yes.
and daily basic you can focus on one story at a time,
Yes.
and you will be having novels and good films.
Okay. All right. You said no bills.
No,
I like that.
films.
All right.
Yes.
No
yes.
Bill Studio. That's gonna be my.
That's yeah. Name it no bills. It will bring money, so you
That's
you
the
pay
goal,
your
right?
bills. Really, believe me, the life or the world is full of sad and bad and unhumanity stories.
Yes.
Need attention from a human being, even to shed some light about it.
Yes.
To let people know about it. It's sad to be like far away from us. No, it is hurting us because people come to us with their trauma and their things.
Yes.
So we have to remember that we are a human being.
Yeah.
And the best part, to fix up the pain, to feel that we are a human being. So really, if you need help with access, any way for stories, or
All right.
there's a lot of things we can help with.
Cool.
Access Sacramento.
Yes,
There you
Access
go.
Sacramento. So we'll see what we can
All right.
find out.
Great.
So far, so good. Let's have a break and see what we can close the show with. We'll be back soon. So I like to end the show with some kind of hints and points. Access Sacramento mission that they help the voice, the people who have no voice in media, to raise their voice, which help us, help other people. Just to let you know how many nationality we are here, just in this small setup in Access Sacramento. Where are you from?
Western Africa, Native American, and parts of Eastern and Southern Europe.
Where are you from?
Not as eccentric and extravagant as Andre, but I'm from Iran.
Iran.
Yeah, I was born in Iran. We came here when I was 7, right before the revolution. Yeah.
And I'm Arab from Palestine. Israel down. So three of us have different nationality, different background, but all of us talking about humanity and how we can help. Through Access Sacramento, who helped us to begin with. And that's the beauty of community TV and community service. And I invite you to be part of any good service helping the communities. There is a lot in need for helping communities. Our chiropractor gave us a help with his medication. I'll let him repeat it as a gift from his show to you, and you try it. Let us repeat that.
Thank you. I will make this available to anybody who wants it through Access Sacramento's link. I'll post it on their website, whatever they have available. But for arthritic pain, we use 2 tablespoons of honey and 3 teaspoons of cinnamon. So the combination really is between honey and cinnamon.
So mix it up.
Yes. When I say mix it up, you want to mix it up like, let's say in a 8-ounce glass, like like one of these glasses of hot water. You kind of mix it like as if you're making,
Syrup.
anything.
Drink.
Yeah, exactly. 8 ounces of water.
Don't broil it.
Hot water.
Hot water.
Yes,
Okay.
hot, warm water, lukewarm water, where it dissolves. Because honey.
Once a day.
Twice a day actually. If you're starting as a program, again, this is what I'm telling you. This honey and cinnamon. This is a regimen that you cannot like overdose on it. It's not harmful. So let's say you put a little bit more here, a little bit more there. You're not gonna die from it. It's just it's natural stuff that we use on a daily
Also,
basis.
it depends how you handle it.
Exactly.
Your body.
Exactly. Initially, for depending on the condition that you have and how severe your arthritic pains are, I would recommend doing it first thing in the morning in a 8-ounce glass of water. You want to mix it in a warm, hot glass of water because it has to dissolve. Otherwise, it's pointless. And then in the evening before you sleep. Now, mind you, you want to give about an hour to 2 hours between this so that your body can absorb it and digest it. It needs to absorb into the digestive system, and that's the whole point of this. If you take it right after you eat, it's not going to do you much good because your body's already got food that has to digest, and it's going to digest it with it without really differentiating the benefits of honey and cinnamon. That's why I recommend taking it 2 hours before you sleep and then an hour before you eat your breakfast.
That's wonderful.
Right, and I will make this information available. And then, by the way, everybody can Google honey cinnamon concoctions or honey cinnamon remedies online.
By the way, this is the thing what they have it on the cereal for senior people. The cereal.
Yes,
and
yes.
the cooker oil.
Yes.
It has at the top honey and cinnamon.
Right, but then you don't know what kind of But
I mean, it's useful. It's good for
sure.
health.
Again, but that's true. But but what from my studies is I mean you can eat that, but also this to me, what the best getting natural honey if you can buy it from a farm that actually has like a bee colony that actually raises and makes honey. That's the best.
Yeah.
Because
the market now they sell each area the honey make
even the
honey,
farmers market in downtown.
Bees make the honey from that area for
absolutely.
allergy. They recommend that to buy from
the
your
combination
area.
between honey and cinnamon is profound. It can do so much for people's health. Again, mind you, it's not something you take one day and you're like, oh, am I great? Oh, am I feel great? Hallelujah. No. Like anything else, you got to give it some time, like 30 days.
Yeah.
About a month, 3 to 4 weeks, to
You'll
let your
see the
body
result.
adapt to it. But your body will absorb it because your body needs it, and that's what's so wonderful about honey and cinnamon. It's very good. I mean, I've done it. I have my parents doing it. It's really great. And for the and going back to your question about the baby boomer generation, this is something that they can definitely use. It's cheap. It's effective.
It's available.
It's super available. It's not especially in the Sacramento area. We have farmers markets. We've got. I mean, it cannot get better than this. It really cannot. I mean, people who don't take advantage of this, they're not watching the show.
Our friend.
No, I mean seriously.
Our friend Mary on the camera cut her attention. Your daughter's name. What is the meaning of
My daughter's name is Donya. Donya means the world, and she's the world to me. And I have a picture of her, and I can show it if you'd like. But Donya means the world, and to me she's the world. And the reason we named her is because we have one daughter, and God willing, love to have more than one child. But she's wonderful, and I love her. And
she's your ward.
she's wonderful.
Yeah.
If I show you a picture of her, you'd be like, oh my God.
What is your picture?
Oh,
Talking about picture, show.
I apologize. Hold on. Sorry, I turned off my phone.
Don't worry.
Oh, yeah.
Technology. I thought a picture.
So how about the knives, right?
So that was a great advice for our viewers, actually.
Absolutely, honey and cinnamon.
Is there any exercise too?
Well, the best exercise anybody can do on a daily basis is to, when you wake up, your body feels more tight. And that's because you've been sleeping, and because of gravity, what happens is your tendons, which is what connects the bones to the muscles, and sometimes people get that mixed up between tendons and ligaments. What's the difference between tendons and ligaments? Ligaments attach bone to bone, tendons attach bone to muscle. So we're talking about tendons. And so when you wake up, the tendons, which attaches bone to muscle, they're tight. And that's because you're lying down for 6, 7, 8 hours. They shorten. And that's why when you wake up, you tend to be a little bit more sore. And so what you do is you do stretches. You do a series of stretches, and as well as doing walking, help increase circulation. That blood circulation helps bring more oxygen, and your body starts loosening up. So a lot of times say, oh, I'm sore when I get up. And a lot of times I tell my patients that want to come in for chiropractic care, new patients, like, oh, I only have pain when I wake up, whatever. And I tell them, like, well, do you loosen up? And they're like, what do you mean loosen up? I'm like, well, do you walk around? Do you stretch? Oh, why don't you do that? I've been healthy for 40 years, blah, blah. But I tell them, like, look, everybody, whether you're 20 or 80, you need to walk and stretch. It's important. You need to get the circulation going in your body. Because when you sleep, everything's short, everything constricts, and you need to walk and loosen everything up. And it's important, because that's what we do. And it's because of the way the body reacts. And that's kind of pretty much how it is.
You remind me school time, when we were young.
Yes.
We salute the flag, then the stretches in the backyard.
You know what? I did it too when I was younger, but I won't.
We were living healthy life better than now.
Yes, and it was fantastic.
That's good. What about you? What do you like to tell us? What do you focus on? What do you need as help from us?
Oh wow, I have quite a few projects that I would like to get produced, and so would you like titles of projects or?
I like to see you when you need help.
Good.
We are willing to help as
Awesome.
much as we could. You have
Awesome.
interesting ideas, and
Yes.
you have something in mind we might share with you. That's
Yes.
my point.
Yeah.
And what about the exercise, what he gave you? What is the best help you in your situation?
Oh wow, Chris gave me a ice pack. He's helped me to, when I sleep, to recreate the curvature in my neck, and I do have exercises and stretching that I received from my physical therapist. So there's quite a few things that I have to do in order to actually be here today, in order to look healthy and things like that.
Thank
So,
God.
but even as I sit here, there's pain radiating through my neck, and
But you made it, and you came over.
yeah,
Thank
it's-
you for coming.
Right, yeah.
Thank you.
I consider myself very blessed. I was millimeters from being neck down, paralyzed. There are many people who are in wheelchairs, or they are
Yeah.
somehow deformed or
Sad to see.
disabled. So I just consider it something that I deal with, and I'm just grateful, and I try to get back, and that's why I'm here.
That's wonderful. Great to hear good news.
Did we see that
That's
picture yet?
We'll close the show with the picture.
Sure. Absolutely.
By the way, where is your office?
My office is at 2716 V Street, V's in Victor, in Midtown Sacramento, where we've got, right by the Crosstown Freeway, 50 and the 80, very easy accessible, and,
Do you have website?
I do have a website. It's called arbabianchiropractic.com, or Dr. Arbabian, as it spells, or Dr. Arbabian.com, and
We'll have that information. on the
absolutely,
screen.
absolutely. So yes, we're here for the community, and we're here for you.
Thank you, really. Really, on behalf of my viewers, I would like to thank you both. Thank you for coming over and tell me about our guest,
You're
and
welcome.
really appreciate the value of being having good treatment.
Yes.
You came to share our viewers that value. Really, I appreciate it. Felt
welcome.
with the community. I felt with the need of spread the word. I really appreciate it. And thank you for coming after hassle. After
No,
But,
this has been.
it's your place.
This
anytime.
is the most fun I've had since spring break of 1992.
What was it? Spring break?
Long story.
Okay,
I've just had a lot
show
of-
me your daughter's
Oh
picture.
yes, absolutely.
I really thank you on behalf of my
Thank you.
viewers.
Thank you
and
so much.
on
I had
behalf
so
of
much-
my
I had a great
guests,
time.
I would like to thank you, my viewers, for sharing with us this evening. And hopefully you will benefit from the information what we get through this show. And hopefully every time we'll bring you something different to help you learn about who is around you and take advantage of being human, helping our communities to do better. Thank you for watching. We'll see you next time. So you can take this one.
All right.
This is Dunya.